Hello, my name is Dr. Dewan S. Raja. Today I will discuss the anatomy of the some of the foot. I have questions and answers. Dorsalis pedis artery is a continuation of what artery and at what location? Dorsalis pedis artery is a continuation of anterior tibial artery and its name changes in between the lateral malleolus and medial malleolus in front of the ankle joint once it passes under the superior extensor retinaculum. What is the course of the dorsalis pedis artery from the beginning to termination? Dorsalis pedis artery passes over the dorsum of the foot lateral to the tendon of the extensor hallucis longus. It goes to first intertoo space, and before going there it gives multiple branches. At the very beginning it gives some tarsal branches like medial tarsal artery, and close to its termination at the base of the first intertoo space it gives the arcuate artery, and it has a penetrating, perforating branch that goes down between the two head of the first dorsal interossei of the foot, and it unites with the lateral plantar artery to complete the plantar arch in the sole of the foot. What are the branches of dorsalis pedis artery? We just discussed arcuate artery. The first digital branch to the great toe. Also, it gives branches like medial tarsal artery, lateral tarsal artery. How can you palpate the dorsalis pedis pulse? This is palpated on the lateral aspect of the tendon of the extensor hallucis longus on the dorsum of the foot. How can you palpate the dorsalis pedis pulse? We just discussed that. What is the clinical relevance of absence of dorsalis pedis pulse? Dorsalis pedis pulse may be absent as a complication of atherosclerotic diseases like long-standing hypertension, hypercholesterolemia, also in diabetes mellitus, that may lead to peripheral vascular disease and occlusion of the blood vessels. But dorsalis pedis artery may also be absent if there is any congenital anomaly, the non-development of the dorsalis pedis artery. In that condition, other arteries surrounding artery will be larger, and we may not get the dorsalis pedis artery pulsation lateral to the extensor hallucis longus tendon and medial to the first slip of the extensor digitorum longus. What imaging studies used to assess the patency of the dorsalis pedis artery? It can be done by Doppler's ultrasonography. We can assess the patency of the dorsalis pedis artery. Okay, so this is the anatomy. The anterior tibial artery, it becomes the dorsalis pedis artery. Once it got between the lateral malleolus, medial malleolus, then it gives branch like that to medial tarsal branch, lateral tarsal branch, arcuate branch, and also the dorsal metatarsal artery, dorsal digital artery here, and from the arcuate we will get other dorsal digital branches, metatarsal branches, and the termination goes down as a perforating artery between the two head of the dorsal interossei muscle here, okay, and that goes to the plantar surface and unite with the lateral plantar artery to complete the plantar arch. Branches, we found the arcuate artery, we got the tarsal artery, we got the metatarsal artery and the digital branches. Okay, what are the tendons that passes under the inferior extensor retinaculum of the foot. This is the tibialis anterior, extensor hallucis longus, extensor digitorum longus. Then we have the fibularis tertius. What is the attachment of superior extensor retinaculum and inferior extensor retinaculum? Superior extensor retinaculum is attached to the lower part of the tibia and fibula. Inferior extensor retinaculum is attached, it is Y-shaped. The stem of the Y is attached to the calcaneus, and the splitted upper band goes to the lower part of the tibia. The lower part of the splitted Y-shaped structure of the inferior extensor retinaculum blend with that of the plantar aponeurosis. What is the nerve supply of the long tendon of the dorsum of the foot? This is the deep fibula. What are the intrinsic muscles in the dorsum of the foot? This is the extensor digitorum brevis. The slip go to the great toe is also called extensor hallucis brevis. With the nerve supply of the intrinsic muscles of the foot, nerve supply is provided by the deep fibular nerve. What are the cutaneous innervation over the medial malleolus? Medial malleolus, this is the saphenous nerve, a branch of fibular nerve. Lateral malleolus, that is done by the sural nerve, a branch of tibial nerve. First intertoo space, deep fibular nerve, that is the branch of the common fibular nerve. Lateral margin of the foot by sural nerve, a branch of tibial nerve. Medial margin of the foot, this is mostly done by the saphenous nerve and the medial plantar nerve. Medial plantar nerve is a branch of the tibial nerve. From the ball of the great toe, there is the saphenous nerve. There is a branch of the femoral nerve. Okay, we got that. So, tendon, the tibialis anterior, extensor hallucis longus, extensor digitorum longus, this is the extensor digitorum brevis, and this slip of external digitorum brevis is called extensor hallucis longus. Inserts to the base of the proximal toe of the great toe. These small tendons of the extensor digitorum brevis inserts to the dorsal digital expansion of the flexor, dorsal digital expansion of the extensor digitorum longus here. Okay, so you got this is the extensor digitorum longus. It makes dorsal digital expansion, and there from the lateral aspect we'll get the insertion of the extensor digitorum brevis to the middle phalanx of the second, third, fourth toe, fourth and fifth toe. The fibularis tertius inserts to the dorsal aspect of the base of the fifth metatarsal bone. Okay, so we got the extensor digitorum longus here. Now we'll go to find out the nerve. We have the deep fibular nerve supplies the muscle here. Superficial fibular nerve provide the cutaneous innervation, and the intertoo space cutaneous innervation is provided by the deep fibular nerve. So this is area for deep fibular nerve. Lateral malleolus by the superficial fibular nerve, medial malleolus by saphenous nerve. This part by the superficial fibular nerve, extreme in the lower part will get the contribution by the medial plantar nerve, but mostly this part is supplied by the superficial fibular nerve. What are the sites of insertion of tibialis anterior to the medial cuneiform and first metatarsal, extensor hallucis longus to the base of the distal phalanx of the great toe, extensor digitorum longus by dorsal distal expansion to the base of the distal phalanx of the second, third, fourth, and fifth toe. Fibularis tertius to the base of the fifth metatarsal bone, extensor digitorum brevis inserts to the extensor digitorum hallucis will go to the proximal phalanx. Extensor digitorum brevis, other tendons will go to the middle phalanx of second, third, fourth, and fifth toes. Extensor hallucis brevis will insert to the base of the proximal phalanx of the great toe. What muscle inverts the foot? Foot is inverted by the tibialis anterior, tibialis posterior. Okay, nerve supply of tibialis anterior is fibular nerve, tibialis posterior is tibial nerve. What muscle everts the foot and what are their nerve supply? Muscle is everted by fibularis longus, fibularis brevis, and their nerve supply is from the superficial fibular nerve. What movement take place in subtalar joint? Inside the subtalar joint has inversion and eversion movement. What is the main arterial supply of the dorsum of the foot? There is the dorsalis pedis artery. Dorsalis pedis artery passes through which muscle to anastomose with the plantar arch. It passes through the two head of the first dorsal interosseous muscle. Arcuate artery is a branch of which artery? It is a branch of the dorsalis pedis artery. Which structure is located lateral to the dorsalis pedis artery? That is the which structure is located lateral to the dorsalis pedis artery? That is the first slip of the extensor digitorum longus. The web space between the first and second toe is innervated by the which nerve? Cutaneous innervation from this area is carried by the deep fibular nerve. Most of the skin of the dorsum of the foot is innervated by which nerve? By the superficial fibular nerve. Cutaneous innervation to the lateral side of the foot is provided by which nerve? By the that is done by the sural nerve. The dorsal venous network of the foot is drained to which two veins? The great saphenous vein from the medialis part, the small saphenous vein from the lateral part. The dorsalis pedis artery is palpated on the lateral side of which tendon? Extensor hallucis longus tendon. Foot drop and inability in toe extension are features of which nerve lesion? Lesion of the deep fibular nerve. Okay. A tight fitting shoe is most likely compress the nerve on the dorsum of the foot. Okay. Which nerve? That is the deep fibular nerve. Absence of dorsalis pedis pulse may indicate why there is some atherosclerotic changes, maybe diabetic complication or hypertensive complication. Lumen of the dorsalis pedis artery is blocked, or it may be a congenital defect, artery course differently, or artery may not develop. It is compensated by other arteries. Dorsiflexion of the foot involves contraction of which muscle? Dorsiflexion is done by all long tendons like that of the tibialis anterior, extensor hallucis longus, extensor digitorum longus. Okay, so they help in the dorsiflexion. Which muscle both dorsiflex and inverts the foot? There is the tibialis anterior muscle. Which artery contribute to the plantar arch through a perforating branch? That is the dorsalis pedis artery, which ligament supports the dorsum of the foot and prevent bow stinging the tendon on the dorsum of the foot. That is done by the extensor retinaculum, particularly inferior extensor retinaculum, and also by the superior extensor retinaculum. Which extensor digitorum longus tendon divides into the extensor digitorum longus tendon divides into how many slips? 4 slips. A 22-year-old athlete presents with foot drop and an inability to dorsiflex the foot. He also reports numbness over the first dorsal web space, which nerve is most likely injured. Okay. Foot drop and inability to dorsiflex the foot. That means all long tendon is gone, so deep fibular nerve. It also reports numbness over the first dorsal interdorsal wave space. There is also the cutaneous innervation that is provided by the deep fibular nerve. The nerve would be the deep fibular nerve. A 50-year-old diabetic patient complains of burning sensation and reduced sensation across the dorsum of the foot, sparing the wave space between the first and second toes. Which nerve is most likely affected? This is superficial fibular nerve. A patient presents with difficulty extending their toes after sustaining a deep laceration across the dorsum of their foot. Examination reveals weakness in the toe extension but intact dorsiflexion of the foot. Which muscle is most likely affected? Answer should be extensor digitorum brevis. That also includes the extensor hallucis brevis. A 35-year-old runner complains of numbness in the web space between the first and second toe after starting a new training program with tight-fitting shoes. On examination, she has intact motor function but reduced sensation in this area. Which nerve is most likely compressed? Okay, that is the deep fibular nerve. Okay, so it is cutaneous innervation, deep fibular nerve. So that's all about the Q&A session for the dorsum of the foot. Remember, the medial border of the foot is mostly covered by the superficial fibular nerve, partly on the undersurface near the plantar aspect, the medial plantar nerve. From the ball of the great toe, we'll get the great saphenous nerve. The lateral aspect of the foot, our cutaneous innervation by sural nerve. And that's all for today. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.